If you've tried to contact your GP recently, you might have noticed something new. Instead of speaking to someone straight away, you're asked to fill in an online form. It can feel strange, especially if you're used to calling the surgery and booking in over the phone. Some people even wonder if it's just a way of putting up barriers. But that's not the case. This system is designed to help the practice work more efficiently and to make sure people are seen in the right way at the right time. When it works well, it can actually save time for everyone, including you. But if you're not sure what to write in the form, it can feel difficult to get the help you need. That's why we're here, to talk through how you can make it work better for you. Most GP online forms ask you to describe your symptoms or your reason for contacting them. Even if the questions aren't labeled in a particular way, your GP team will be looking for three things: what's going on, what you're worried about, and what you hope will happen next. Let's break those down. First, what's happening? Don't worry about using the right medical language. Just describe what you've noticed. For example, instead of saying pharyngitis, you could write, "My throat's been sore for 5 days. It's worse when I swallow and I've had a high temperature." This gives the clinician clear information to start with. It shows what the problem is, how long it's been going on, and how it's affecting you. Next, what are your concerns? You might be worried about how serious it is. You might be scared it's something like cancer or a long-term condition. Or you could be feeling anxious because it's something that keeps coming back. Whatever it is, say so. Writing this down can feel a bit personal, but it helps your doctor understand what's really on your mind, not just the physical symptoms. Then, your expectations. This is where you can say what you're hoping will happen. Maybe you think you need a face-to-face appointment, a test, or a prescription. You might want a note for work or school. Or maybe you're just not sure and want some advice. It's all helpful. Don't worry, saying what you want won't affect how your concern is treated, and it doesn't mean you'll always get exactly what you've asked for, but it helps the team match you to the right person or service. Now, let's talk about how much to write. Some people write just a few words, like rash or bad knee, but that doesn't give the team enough to work with. Others write a huge amount, including every detail of the last 20 years. That can make it harder to see what the current issue is. A good rule of thumb? A few clear sentences is often enough. Describe the problem, say what you're worried about, and tell them what you hope for. And don't forget, the first person to read your form may not be your GP. Many practices use trained non-clinical staff, sometimes called care navigators, to review incoming requests. These team members are trained to help direct your concern to the most appropriate person. That could be a GP, but it might also be a nurse, pharmacist, physiotherapist, or mental health specialist. This doesn't mean you're being fobbed off. It means your surgery is working to match people to the right kind of care, so the system works better for everyone. If the team understands what's going on and what you need, they can respond more quickly. And if your concern is urgent, having a clear message makes it easier for them to spot that and act fast. So what if you're not sure what to say? A useful tip is to imagine how you'd explain it to a friend. You'd probably say something like, "I've had this pain in my chest since Monday, and I'm a bit worried because it's not going away." That's exactly the kind of thing your GP needs to know. And if you're struggling to put it into words, that's okay. Just write what you can. The team will follow up with questions if they need more detail. Remember, the online form isn't a test. You don't need to use medical terms or guess the diagnosis. Just describe what's going on in your own words. It's also helpful to include how it's affecting you. Is it stopping you from sleeping, working, looking after your children? That kind of detail helps your GP understand how much impact it's having on your life. And one more thing, if your surgery offers phone support to help you fill out the form, don't be afraid to use it. You can call and say, "I'm not sure how to use the form," and someone can help you through it or fill it in with you. In the end, this system is there to help, even if it doesn't feel that way at first. By understanding how to make your message clear and useful, you're more likely to get the right support and get it sooner. So next time you use your GP's online form, remember this simple structure. What's happening, what are you worried about, and what do you hope will happen? It's a small shift in approach, but it can make a big difference. If you found this video helpful, subscribe to our channel for more straightforward, trusted health advice. We're here to help you make sense of the NHS and feel more confident about your care.